Awesome. Well, thank you, everyone who's joining us. We're so excited to be here today talking about WIC. And I know last week we had some really great information about from Angelica at Innovate Memphis about food policy, but we really wanted to dive deep on the WIC program. And in talking with Anna Grace, I learned that WIC is so much more than just getting people food, and there's a lot more to it than that. So I'm excited for her to share a little bit more about that. But yeah, so before we get started, I would love to introduce Anna Grace Breedlove, the Anti-Hunger Policy Coordinator for the Tennessee Justice Center. So, hey, Anna Grace, and can you tell us a little bit about yourself and your work at the Tennessee Justice Center?
Sure. Thanks so much for having me, Nina. I have been at TJC for a little over 2 years now, and the first year and a half, really, of my work at TJC, all I did was eat, sleep, and breathe WIC. And so I get really excited when people give me the opportunity to talk about it because it's an awesome program. But like I said, when I started at TJC, it was just WIC work, and that was predominantly because TJC had received a federal grant called WIC Community Innovation and Outreach. And it was a grant from the USDA that was awarded to 36 organizations across the country. And it was aimed at targeting trying to understand in these various communities and states why WIC is underutilized, and how can we increase the utilization of the program. And so TJC was one of those organizations, and I was hired to work specifically on this project. So that's how my work started at TJC. Now I touch WIC and also summer EBT, which is another child nutrition program, which we can talk about a different day if you'd like. And then I also do some safety net access work specific to immigrant communities. So yeah, been at TJC for a little over 2 years. I studied Spanish and social work in undergrad and then my master's degree as well. So that's a little bit about me.
That's awesome. Thanks so much, Anna Grace. And as we were kind of talking about a little bit earlier, you are our second TJC person to be featured in this series. We love Jane, and we're so excited to have her speak about kind of an overview of the public benefits
Mhm.
programs earlier this month. Um,
She's awesome.
so I was wondering if just to kick us off, you could tell us a little bit about like what is the WIC program and how did it come to be?
Yes. So WIC is an affectionate name for a long name. It stands for the Special Supplemental Nutrition Program for Women, Infants, and Children. And it actually came to be a program initially started in 1974 and then became a permanent program by the USDA in 1975. And it was actually started in partnership with physicians in Kentucky that were noticing that low-income families were giving birth to babies that were smaller than average, both in height and length, and also that moms were struggling with anemia or iron deficiency. And so basically, the purpose of WIC was because physicians had established that low-income families were not being able to meet the nutritional needs during pregnancy and for their young children, so that moms were, not any fault of their own, just because of their circumstances, were giving birth to babies that lacked the support during pregnancy in order to have a healthy birth. And so that was the impetus to start the WIC program. And WIC has, ever since 1974, been providing nutrition support to pregnant and postpartum moms and children under the age of 5. And so there is a lot of similarities between WIC and some of the other nutrition safety net programs, and we'll get into those similarities and differences probably here in a little bit. But for starters, like I mentioned, WIC does target women, infants, and children. It's in the name. There are a few caveats to that, but really its purpose is to ensure that pregnant and postpartum women give birth and are able to breastfeed healthy children, and then to continue to target the growth and development of healthy kids by providing the necessary nutrients until they turn age 5. And so you can participate in WIC as soon as you test positive on a pregnancy test. for 6 months postpartum if you're not breastfeeding, and for 1 year postpartum if you are breastfeeding. And then the child can participate until they turn age 5. And as soon as they turn age 5, then their WIC benefits cut off. But you may be asking what WIC provides. And most notably, and what people know WIC most often for, is the food benefits. That's the biggest piece of the program, but WIC provides more than just that. And the food benefits are even a little bit different than just like being able to go to the store and picking out whatever you want. And so basically, when you enroll in WIC, you receive almost like a prescription of a food package that you can purchase. And that prescription or food package depends on whether you are a breastfeeding mom, a postpartum mom, or an infant, a 3-year-old child. There are lots of different packages that WIC prescribes you. And those packages include milk, eggs, cheese, yogurt, bread, beans, foods that are included in the package because they provide some nutritional value to growing and developing kids and moms. And in addition to the food package, WIC also provides nutrition education and counseling. So when you're enrolled in WIC, you meet at least once a year and sometimes every 3 months with a nutritionist, where you can ask questions and they can provide guidance about the types of foods that you're getting through your WIC package and what that targets for your children and yourself. And then additionally, they provide breastfeeding support. And then WIC is also a connector to other health and social services. And so if you're meeting with WIC and your nutritionist notices that your child also needs dental care, then some health departments can connect you with the on-site dentist. That's what happens here in Davidson County. So WIC also provides referrals to other health and social services. The other part that I want to mention about who is eligible, I referenced a caveat to the women, infants, and children. But if you are a caretaker relative of a child under the age of 5 and you meet the other parts of WIC eligibility, then you can participate in the WIC program based on the child's eligibility in your care. So single fathers, aunt or uncle or grandparents who are caring for young children, if they are at or below 185% of the federal poverty line, then they can participate in WIC because their child in their care is eligible. And also the caveat should be provided that foster parents can participate as well. Regardless of their household income, they can participate with their child in the care. But yeah, I think the only thing that I didn't really drill home in that is WIC not only targets just pregnant moms, breastfeeding moms, and young children, but specifically low income pregnant and postpartum moms and young children, to ensure that those families also have access to the nutrients they need to raise healthy kids.
And that's why you're the WIC expert in Tennessee. No, thank you so much
Oh, I
for
don't know about that.
one of at least. Well, I think yeah, that was so thorough and helpful. And I think a couple of just key pieces that I wanted to pull out from there is understanding that WIC is not just a food program, that there are other supportive services that are included, and that the food program operates a little differently than how other benefits like SNAP operate, in that it is specifically targeted to get folks the nutrients that they need when they are pregnant, postpartum, breastfeeding, or young children. So let's dig a little bit deeper into that. So, like I kind of mentioned at the top, we talked about SNAP and food policy last week. And even though SNAP and WIC both provide food assistance, can you highlight some of the differences between the two programs and why someone might benefit from enrolling in both? Because I think some folks don't realize that they could enroll in both.
Yes, we get that question pretty consistently, actually, that families don't know that they can participate in SNAP and WIC at the same time. And the answer is yes. But yeah, I think it's really important to distinguish the two programs, because, like I said, most people know WIC by the fact that it provides food, and that's obviously what SNAP does too, but WIC provides a lot of services in addition to that. And so it's a little bit more of a wraparound service that WIC would be providing than maybe SNAP is. But the major differences between the two programs are like I mentioned, they're both food programs, but they provide vastly different options in food. SNAP, you receive a quantity of dollars that you can purchase food in the grocery store, and the WIC food package is very different in that not only are you only allowed to buy very specific products, but also it's not a monetary amount that's attached to your card. It's a specific list of quantities of that product. And so you can get, 2 dozen eggs or 16 ounces of bread or 32 ounces of milk. And so although sometimes that creates confusion in the store, ultimately it's exciting because as we know with inflation and the cost of groceries, if your dozen of eggs is $8 a dozen or $3 a dozen, you can purchase that with your WIC benefits, and it doesn't impact your ability to purchase the other products in the WIC food package. But the only caveat to the quantity-based WIC food package is that there is a cash value fruit and vegetable benefit that works a little bit more like SNAP, but you could just spend it on fresh or frozen fruits and vegetables. And so for children in the program, that's $26 a month. And if you are a pregnant or breastfeeding mom, it ranges from $47 to $52 a month. And that cash value you can spend on whatever you want in the produce section, really. It's at the participant's choice. And that is something that people were really excited about. Before, I think it was September of 2023, or the fall, let's say the fall of 2023, those cash value benefit amounts were drastically lower, like between $9 and $11 a month that families were getting, which I'm sure you're aware, Nina, would not purchase very much anything fruit and vegetable wise at the grocery store if that's the amount that you had. And the amount had increased during the pandemic, but that was only a temporary waiver. And so in the fall, those amounts permanently increased. And so now families can count on having a larger fruit and vegetable benefit. And so that's a reason that attracts a lot of families to the program. So that's a side note. One of the biggest differences between the two programs is the food package. And then also, as we've already referenced, the big difference between the two programs is that WIC is not just a food program and provides breastfeeding support, nutrition education, and also referrals to other health and social services. Another difference is that the people that can participate in WIC is a smaller crowd that can participate in SNAP. As we've mentioned, WIC is extremely targeted. And so if you are not pregnant, postpartum, breastfeeding, or a young child, WIC is not for you. And that's obviously not the case for SNAP. SNAP reaches a lot more families. And then another difference that is one that's important, especially right now to note, is that there's not an immigration requirement to participate in WIC like there is for the SNAP program. And so that's something that we like to bring up consistently because many families confuse the two programs, and many families could smartly assume that if one government program would be administered like the next, but that's not the case with WIC and SNAP, and WIC is open to a lot more families than SNAP is. So those are probably the main differences that I would say between the two programs. But if I think of something else, I'll mention it throughout this conversation.
Yeah, I think one thing that really helped me when you were explaining this all to me the first time was understanding WIC as like more of a prescription food package than, cash or than benefits. So, and I think you kind of rightly named there is some benefits in that you're getting the nutrition that has been approved by a doctor and not just the amount of things that you can buy with the money on your EBT card or something like that. But at the same time, it does make it restrictive. So I think that's a really key point, and that like distinction really helped me understand the difference. So just want to highlight that and thank you for that.
Yeah, no, good point. Yeah, I think Nina's right that on one hand, like that's what WIC is designed for. And so we're thankful for the fact that it's a program targeting the health needs of pregnant people and young children. But at the same time, if you are an immigrant and not used to eating foods in the United States and don't have much freedom to pick out something that your family would eat in the store, then WIC may not all, be very helpful to you. And so we do hear from some families sometimes that they elect not to participate in WIC because they don't find the food package to be useful. So
Yeah.
there are downs to it too.
Yeah, that's definitely helpful. And an excellent segue to our next question, which is I was, when we first started talking, I had kind of mentioned that a couple of years ago, I noticed that Tennessee was like last in the nation in terms of eligible WIC enrollment. I think we've made some improvements, probably in part because of the work that you're doing and others are doing. But even though we're still kind of ranking in the bottom in terms of eligible WIC enrollment. And so I was curious what you see are some of the biggest challenges, both like in applying for WIC, but also, like choosing WIC. It sounds like you've named a couple, but I'd love to hear more about that. And also how those challenges are felt like differently by different communities. So I really appreciated you kind of like naming that, yeah, the food package does kind of follow like a very specific white standard American diet and not necessarily culturally relevant or foods that someone might want to buy. So would love to hear more about all of that.
Yeah. Um, so I guess for starters, maybe I should have mentioned this in the intro. What Nina's referring to is the coverage rate of WIC in Tennessee. And so across the United States, and especially in Tennessee, there are more people eligible for WIC and not participating in the program than there are eligible people actually participating. And so in the state of Tennessee, from measures from 2022, 43.7% of eligible WIC families are actually participating in the program. So that leaves a lot of families on the table that are eligible for WIC benefits and for a wide variety of reasons aren't choosing to enroll in the program or don't know that the program is there to help them. And so that's a big piece of the WIC Chow project that I mentioned when I first started this conversation that we were digging into, like why is it that the coverage rate is so low in Tennessee and what is keeping families from participating in the program? And I think there are a variety of reasons, and I'll just touch on like five or so here. But the first one being that there's a lot of misinformation about the program out there. People don't understand who's eligible. If they think they're eligible, they may think that their child can just participate while they need formula. And then after that, they're not eligible for WIC anymore. We've heard from some families that, oh yeah, I participated in WIC and then my child turned 1, so I wasn't eligible anymore. And we're like, no, you're eligible until the child turns 5. Lots of misinformation about immigrant eligibility, and then just misinformation generally about the package, about participating in SNAP, so I can't in WIC. And so that was a big piece of the project that we were working on was how can we just build general public awareness around the WIC program so that more families who are eligible know that they're eligible and understand how to enroll in the program? So I would say general misinformation is reason number one. The second is that WIC is different in that there is often an in-person component to the program. Used to, before the pandemic, you had to go in person to a WIC office to continue benefits 4 times a year, which is a lot. And then the pandemic happened and everyone was sequestered at home. And WIC adjusted to that by providing counties the option to provide services remotely. And this differs a little bit across the state of Tennessee, but generally, most people are encouraged to attend 1 appointment a year in person at WIC, and that's their certification appointment. And then every 3 months after that, they have a recertification appointment, which sometimes means they just have to like check in with someone on the phone, complete a module on their WIC Shopper app. But some way of maintaining communication with WIC, because like we've mentioned, WIC is also trying to deliver nutrition education, not just the actual food benefits. So all that is to say, if you are in a metro or rural area and don't have access to reliable transportation or your job hours are crazy and you can't get to a WIC office between 8 and 4:30 Monday through Friday, that can be a barrier to being able to participate in WIC. And there are many counties that, like if a family will express that they can't get to WIC, and that would be a barrier to them being able to participate at all, the counties will work with them and enroll them remotely. But that's not in every Tennessee county, and also it's not widely advertised. And so if a family assumes they have to go in person and doesn't know that the option exists to express that to WIC that they cannot, then likely they're not going to call WIC in the first place. Um, and so you see, WIC advocates and WIC staff go back and forth about this because the people that administer the program, they want to serve the families in person, but often the families have trouble enrolling in the program or certifying because they're having trouble getting to the office. And also to enroll in WIC, you have to bring your kids with you, which adds a whole nother something. So if your kids are at daycare and you're at school, then it becomes a whole day affair to take time off from work and go get the kids from school and go to the WIC appointment. And so it can be cumbersome. So a lot of families really appreciate the remote services waiver that WIC has right now because it allows them to maintain access to a program when transportation is difficult for them. The third barrier that we often see is language access, which is consistent among lots of safety net programs, but also is for WIC too. Many non-English speakers may call a WIC office and have trouble getting a hold of someone, or the WIC office may not have the phone tree set up in a way that makes sense to non-English speakers. And so I didn't mention this in my intro and I should have, but part of my work is connecting directly with families that are having trouble connecting to WIC. And that is oftentimes immigrants or non-English speakers, just because it's not that they lack the ability to get connected to the program, but they call someone and then they can't get a hold of someone that can actually serve them in their language. And so that's a problem that we see routinely. Two more and then I'll hush, but the fourth thing that I wanted to mention is experienced a fair amount, I think, by families that are trying to benefit from multiple government programs, that at some point it's exhausting, and talking to one state agency after the next and submitting the same paperwork that you submitted to DHS and now the Department of Health wants it. And so there are some families that just throw the towel in with WIC and decide, if those benefits aren't what your family consumes, then why would you go through the effort to enroll in the program? And so that's something that we see every once in a while, is that people just, WIC is one more thing to worry about, and are the benefits really going to outweigh the time that you're going to spend connected to the program? And I'd like to think yes, but that's may not be true for every family. And so sometimes just general exhaustion by dealing with the government is a reason someone wouldn't participate in WIC. And then lastly, a reason that we hear really consistently from all sorts of families is that shopping with WIC benefits is confusing. And you have a specific list of products that you can purchase, and then you get to the store and you get those products, and then you get to the cash register, and for whatever reason, what you thought you could purchase, you cannot. And if you imagine that scenario, how uncomfortable for the family to have brought these products up and the cashier tell them that they can't purchase it. And then the family then has to make the decision, are they going to put that back or check out with using their own money, when it may not have been a product that they wanted to begin with. They were only getting it because it was a part of WIC. And that holds up the line. And so there is stigma associated with shopping, and we know that exists with SNAP too. It's not just unique to WIC, but sometimes it's exacerbated with WIC because the shopping is confusing. So at the end, when we talk about some resources and ways to stay engaged, I'll make sure to mention this again, but there's a WIC shopper app that families can use to scan products, and then it will populate on the app if that product is in their package and can be purchased or is not. And so when we hear families talk about being confused in the store and thinking they can purchase something and then being told otherwise, we encourage them to turn to the app, and that's a really helpful resource. And trying to resolve some of that confusion before they get to the cash register.
Yeah, absolutely. Well, thank you. I know that was detailed, but I really appreciated
Yeah,
you kind
sorry.
of, no, it was perfect laying out some of those barriers because I think it's really important. Like you named, there are a lot of really cool things about this program, and there's definitely some drawbacks and challenges that folks face. Whether it's, kind of dealing with bureaucracy and government, dealing with like the way to implement a program that is largely based,
hmm
on specifics instead of just a general assistance. So I think, yeah, it makes a lot of sense. And thank you for highlighting those. You touched on this a little bit, but I'd love for you to share maybe a little bit more about what services and supports does the Tennessee Justice Center, you and your team provide to either folks who are enrolled in WIC or people who are thinking about enrolling in WIC.
So yes, TJC can help families get connected to WIC. But it's a little bit different than you might imagine because there's not actually an application to fill out to get connected to WIC, like there is for SNAP. And so TJC can't really, fill out paperwork with you for them to send to the WIC office. And so mostly what I do is kind of a warm handoff from the client to the WIC office. So someone may call TJC and say, I'm a Spanish speaker and I'm having trouble getting a hold of someone that I can understand at the WIC office, or I've been hung up on, or no one's speaking Spanish. And so then, although not a perfect system because not everyone has a backdoor entry, I will call on behalf of the client, or if we have a contact in that county, I'll send them an email explaining what the situation is and sending the client's information. Um, in addition to that, I can also send a WIC referral form. And so this is something that TJC continually tries to share with community partners because our goal is not just to educate individuals that would be eligible for the safety net programs, but also educate service providers across the state to be connecting the clients that they serve to resources like WIC. And so we do that by helping people understand how to utilize the Tennessee WIC referral form. And that's a form from the state that you can just fill out the information of the client. It's very brief, like their name and contact information, who is sending the referral. And then you can fax that over to the WIC local clinic that's in the county where the client lives. Not everyone has a fax or is familiar with that, so we would love a more updated way to do that, but that's the system that we have right now, so we're working with it. Um, but so that was probably too much information, but um, when families call and need support with WIC, they'll be connected with me and I will do a warm handoff and then ensure that ultimately they get an appointment scheduled and receive their card and don't have any outstanding questions. But we also encourage a lot of community partners to be referring their clients to WIC as well. And instead of just telling people to, call one more state agency and get connected to these benefits, we can send a referral that puts the ball in the state agency's court to then call the client to get them scheduled for an appointment.
Yeah, that's a great resource. Thank you for naming that. I wasn't aware of that, and I'm thinking, oh, we can put that on our website, and I'll
Oh,
definitely make
totally.
sure we drop the link in the comment or in the description for the recording for this as well.
And I'll also add that if you live in Davidson or Knox County, their WIC clinics have set up a like an online WIC interest form. And so there's no faxing involved at all. You can just go online, you submit your name, once again, contact information, if your child or yourself is eligible for WIC. And that submits that information to Davidson County and then Knox County, two separate forms. And then they will get in contact with you. And that's something that can be filled out by the individual as well, not just service providers. So that's a really, really helpful resource and something that we would love for the state to do, like across the board, to provide another avenue for families to get connected to WIC.
Yeah, absolutely. And for maybe for folks who aren't in Davidson or Knox County, we always at Healthy and Free love to plug the libraries. We know a lot of librarians who will help you fax things, so check out your local libraries if you need that.
And you know what? Now I'm learning something from you because I didn't know that the libraries would help you fax.
Oh, well, I hope so. I think a number of them have fax machines, but I wouldn't maybe. They'll at least know where to get the fax figured out.
True.
Um, uh, but okay, yes. So I did want to touch a little bit on how, like, what we've been hearing about at the federal level in terms of cuts. Primarily, we've been talking about like Medicaid and SNAP cuts, but curious of how like changes at the federal level have impacted or will impact the ability of Tennesseans to access WIC.
A great question. And I will try not to make this confusing. So tell me, Nina, if you're like Anna Grace, you're speaking too quickly and this doesn't make sense. Um, but as Nina mentioned, ultimately, WIC is not a part of the one big beautiful bill, the mega bill that passed. It was not cut in that. WIC is funded through a totally different process, the appropriations process, which I'll mention in a second. And so it was not directly impacted by the cuts to SNAP and Medicaid. However, one of the things that I could have mentioned earlier when you were talking about the differences between SNAP and WIC is that the income thresholds for the two programs are different. And so for SNAP and several Medicaid programs, you have to be at or below 130% of the federal poverty level. For WIC, it's at or below 185%. And so you can use participation in SNAP or Medicaid to show that you're then income eligible for WIC. Obviously, you still have to be, pregnant, breastfeeding, or a young child. But it streamlines the enrollment in WIC because you've already been able to show that you are eligible for a means tested government program that's lower than the threshold for WIC. And so proof in SNAP, proof of enrollment in SNAP and Medicaid significantly helps families enroll and also reduces the burden on state agencies to enroll families and WIC clinics. And so if we're seeing cuts to SNAP and Medicaid, and theoretically, then fewer families are going to be enrolled in those programs, then we can assume that fewer families are going to be able to use that enrollment to streamline their enrollment into WIC, which is in some ways kind of convoluted, but all of the safety net programs are so intertwined. And so we know that, like we mentioned earlier, enrolling in several different safety net programs is exhausting. And if we're taking away a method by which families could streamline that enrollment, ultimately that's not helpful to the families that WIC is serving or the WIC clinic staff that are having to look at all of this paperwork. And so ultimately, families will have to jump through more hoops, and the administrative burden would increase on local WIC clinics as they're trying to enroll families without the streamlined adjunctive eligibility between SNAP and Medicaid and WIC. Another thing that has happened in the past several months is that separate from the big beautiful bill, but there have been several federal agencies that have lost staff, and USDA FNS has not been an exception to that. And so that's something that we're also concerned about. Obviously, the Tennessee Justice Center is concerned about what happens in Tennessee, and what happens in Tennessee can't happen if we don't have staff at the federal offices helping administer the program. And so that's something that we have, we're concerned about impacting ultimately the administration of WIC in Tennessee. And this is an aside, but a plug to the advocates that are listening to this. Today, there's a little bit of a flex between today and possibly the end of the month, but there's currently a comment period open about the reorganization of USDA FNS. And though that doesn't sound like quite as scary as cuts to SNAP and Medicaid, ultimately, if we're reorganizing all of the local regional hubs of USDA, then that means there are lots of people that work in those hubs that would choose to stay where they're located now and not move where the USDA is moving their new hub. And so if you would like to comment on that, you can send an email. It's like reorganization USDA or like at USDA.gov or something like that. I'll correct that later. But that's another thing that's happened recently that we're concerned about is a proposed change to reorganize USDA, FNS, and the regional offices. And so right now we're being served by the Southeast Regional Office in Atlanta, and that office would move to North Carolina, which we know would unfortunately cause us to lose more staff that ultimately help administer the program to families in Tennessee. Um, one more change to note federally. Um, so as I mentioned when I first started this lengthy spiel, is that WIC is funded through the appropriations process. It is not an entitlement program, meaning that the program doesn't grow in its budget to meet the need. Congress has to decide every year how much money they're going to appropriate for it. And so if tomorrow everyone and their brother who was eligible for WIC decided to participate in it, there would probably be waiting lists because right now the program is funded to meet the need, which is who's currently participating. And because WIC is underutilized, all that jazz. But anyways, this year, the appropriations process after the reconciliation bill was passed was starting, and now the Senate has proposed to fully fund the WIC program, but the House has proposed to cut the WIC program. And so that's the next advocacy fight that we're on is to fully fund WIC. Previously, the WIC program has been fully funded every single year, just about. There's a lot of bipartisan support for the WIC program because everyone can agree on typically feeding kids and moms and ensuring that people have healthy pregnancies. And so typically WIC reaches across the aisle and is something that both Republicans and Democrats can get behind. And so we're concerned that the House has proposed a budget. The House Appropriations Committee has proposed a budget that would underfund WIC. And so if you are interested in seeing WIC fully funded, which hopefully you are if you're listening to this conversation, then you can go to the National WIC Association's website or the Food Research and Action Center's website, and they have advocacy actions that you can take to express to your legislators that you want to see WIC fully funded because you want to see pregnant people and breastfeeding moms and young children supported in the state of Tennessee. So that's our next conversation about funding. We've managed to cut the SNAP and Medicaid program, and we're really trying to protect WIC.
Yeah. So it does sound like, ooh, man, things that really are happening at the federal level can have a big impact in Tennessee. Like
Totally.
both by making some of the administrative burdens that are already folks think are too burdensome, even more burdensome, and then
Mhm.
also like this potential cut on the horizon and the reorganization causing staffing and wait times and waiting lists. So I think that's also, yeah, all those pieces, thank you for highlighting them and yeah, and for highlighting what folks can do about it because I do think sometimes it can be a little doom and gloom. But I'll be make sure
Yes.
to post all the links that you mentioned in the description of our YouTube video so that we can have that for folks.
And to not be too doom and gloom, I think we can at the same time we are frustrated that the House Appropriations Committee has proposed to underfund the program. It's also really exciting that the Senate has agreed to fully fund the program. And so there's still opportunity for mediation. None of this is set in stone. And so this is when your voice matters the most and is most important for you to weigh in when there's still time to convince Congress that we do need to fully fund the WIC program. And we've got the Senate on board.
Very exciting. Um, Okay, so I think you mentioned a little bit, and I don't know how much more you need to share about this, but you did kind of mention that, in Tennessee and in a number of federal benefits programs, if you are an undocumented immigrant or don't have meet certain eligibility criteria and are an immigrant, then you can't participate. But that might not be true for WIC. Can you say a little bit more about that?
Yes. So excitingly, WIC does not check immigration status. So whoever you are and wherever you come from, if you are meet the eligibility requirements to participate in WIC, you're pregnant, breastfeeding, or young child, you're under the income threshold, and you live in the state of Tennessee, then you can participate in WIC regardless of your immigration status or lack thereof. And it's just that simple.
That's awesome. Thanks so much for sharing. And then last question, but and you uplifted a couple of ways, but would love to hear more of your thoughts about this. How can advocates get more involved in supporting WIC eligible families? And what are the best ways for Tennesseans to learn more about the resources available and how to navigate them to support themselves and their communities?
Great questions to end on. I think the first is that, if you're listening to this and now you know more about the WIC program and who can participate and what the benefits are, then tell someone you know, a friend, family, neighbor. Ultimately, that's what TJC is trying to do and increase access to the WIC program. Looks like talking to more and more people about WIC so that it's a resource that more and more families know about. So for starters, now that you know about WIC, keep talking about it. TJC runs a monthly coalition group called WIC Champions. And if you're interested in staying up to date about the funding conversation that I mentioned, or knowing what's changing or what's staying the same on the state level with eligibility or how the cuts impact WIC, we meet monthly with the state agency and with community partners across the state to talk about all things WIC. And so if that's a conversation that you'd like to be a part of, that can also be included in the follow-up. And then if WIC Champions is not for you and you don't need another call on your calendar, then you can always join TJC's email list and stay in the loop. We often send advocacy actions, and so the alerts that I mentioned earlier in this conversation where you can send a letter to your legislators to encourage them to fully fund WIC. That would be something that would be in our email list that if you're subscribed to, then you would know about and could submit to your legislators. So that's what I would say as far as like ways to get involved with TJC's WIC work specifically, ways to learn about WIC and like see resources available. I would go to, I'd start with TJC's website. We have a ton of flyers, almost too many, about the WIC program from the perspective of the eligible individual, what community partners need to know, what healthcare providers need to know, because that's not something we mentioned very much in this conversation, but that is the perfect person to be talking to families about WIC. We've got toolkits for grocers and so that we can ease the shopping experience, advertisements for the WIC Shopper app to reduce confusion in the store. So I'd like to think that if you have a question about WIC, there's a flyer on TJC's website that could help address it. And also we have a flyer about the food package. Forgot to mention that. And then it wouldn't be fair to not plug the state's website too. That has all the contact information for the WIC clinics across the state. And so if you're looking to find where your local county office is or WIC clinic, then go to tn.gov's website, and they list every WIC clinic and every county, their address and contact information, which includes their phone number and their fax number. So that's a good place to look as well if you're looking to find it for someone or yourself so that you can give a call to a WIC clinic.
Yes, we're really going to be testing the boundaries of the YouTube caption character limit with all these links, but I think it's
Oh
amazing
gosh.
and awesome that we can provide that support. So thank you so much, Anne and Grace. This was awesome. I learned so much, and I know that our followers did too. So thank you. And to folks who are listening, we'll be back next week. We're doing childcare assistance in Tennessee on Thursday with the Nashville Early Education Collaborative, NEEC. And then we're also doing housing assistance the following week on September 9th with Mari from the Memphis Tenants Union. So we're really excited about that too. And then stay tuned for our keynote conversations on like the future of reimagining public benefit systems that work for everyone. So thank you so much again, Anna Grace, and appreciate everyone's time.
Thanks for having me.